begin with acknowledging this is Paramedic Services Week. And I know that we've put a release out with the recognition of some of the awards that were given. And I'd like to add to that my sincere gratitude and thanks for the hard work and dedication that paramedics demonstrate daily in our communities across Ontario. I know many have been heavily involved in our vaccine response and testing in many different ways throughout this whole pandemic. And so how they stepped in to fill in different areas and step up to the task and moving forward on that. So thank you for your work and dedication then, now, and ongoing is so much appreciated. Since our last update on Tuesday, we continue to see encouraging trends. Yesterday, Wednesday, Ontario reported 1,095 daily new cases, and today we're reporting 1,135. Again, staying around that 1,100 mark for the last few days, in spite of even increased volumes, and the trend usually to have higher numbers today and tomorrow. Ontario's current 7-day average for daily COVID-19 cases is 1,441. This is the lowest we have seen since mid-March. Variants of concern. With respect to variants of concern, the B117, the so-called UK variant, is still the dominant variant in Ontario. But we're continually watching closely for other variants and having consultations with Public Health Ontario and with our medical microbiology team at Public Health Ontario laboratories. This includes especially watching the so-called B.1.617 variant, first identified in India, and its sublineages, about 3 of them. As of today, we are noting that we've identified a total of 322 of the B.1.617 variants that have been identified by Public Health Ontario, 167, and the National Microbiological Laboratory, 155. The majority of these have related to travel cases, and follow-up investigations are underway to determine the origin where these cases had arisen from and to identify if others had not been immediately related to travel. So we continue to look for, continue to identify, and through whole gene sequencing to demarcate which one of the B.1.617 variants it is. Sad today, we're also reporting an additional 42 deaths since Tuesday's update. 23 of those deaths were yesterday and 19 of those deaths today. Again, we extend our sympathies to the family and friends of those and the caregivers who passed away from COVID-19 and are grieving the loss of a loved one at this time. And we're seeing more in the younger age groups as well, and that is as concerning as the other ones. All are losses and all are important. Hospitalizations ICU. We continue to see improvements in these numbers as well. Today, there are 1,072 people in hospital and 650 people in the ICU. This does include 18 approximately of transfers from Manitoba. So our numbers are actually lower than that. And we're going to keep looking at this downward trend, and it's encouraging as our in-hospital transfers have stopped. That means moving from the ward back in, but we still are having some transfers occurring in small numbers around the GTHA. This number is down last week when we had 1,320 patients in the hospital and 721 COVID-19 patients in ICU. Our testing volumes have been dropping. We had 24,008 tests processed Tuesday with a positivity of 5.3%. And today we were processing 37,705 tests, but the positivity was dropped down to 3.6%. This is a important metric, and it's the lowest positivity rate we've seen since March the 20th. The current 7-day average, the percent positivity is 5.5%. That's down from 6.4% a week ago. Again, an encouraging trend. Excuse me. As we see our daily case numbers, rates and hospitalizations decreasing, our immunizations continue to increase. To date, more than 8.5 million doses of COVID-19 vaccine have been administered in Ontario. I'd like to reiterate what I said on Tuesday with respect to the Moderna vaccine. If this is the vaccine that is offered to you, please feel confident to receive it. Excuse me. Dry throat. The vaccine is an mRNA vaccine, like the Pfizer, and is safe and equally effective. My concern is that if people are turning down opportunities to get vaccinated because they are waiting for a different vaccine, they risk contracting COVID-19, not something any of us want. Overall, excuse me, the trends are continuing in the right direction and our situation in Ontario is improving. The provincial cases have decreased by 6. Excuse me. The provincial case rate has decreased by 23% in the last week, and full data to 85.3 cases per 100,000 in the province of Ontario. The R effective is down to 0.82. This is really good news. Our hospitalization ICU admissions remain high, but they are coming down and improving. These encouraging trends are because of our continued efforts to adhere to the public health measures and because we are rolling up our sleeves to get vaccinated. So overall, going in the right direction, moving assertively, bringing the numbers down. If we keep going this good direction, we will soon be able to look at entering in our framework and moving ahead on that. So again, thank you for all you're doing. Remain vigilant over the weekend coming up. Continue to go out and get vaccinated when your turn comes. And make sure that you check to see if your turn is coming and where you can go to access the right vaccine at the right time. So consult and check on that. Show up, get vaccinated, but continue those public health measures. Because remember, after you get the vaccine, it takes 2 to 3 weeks to have effect. I don't know if Dr. Heyer wants to make any further comments or to go over to questions.
I think we'll go over to questions, Dr. Williams.
Thank you very much. Over to you, the media.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Dave Withers, Global News.
Good afternoon. Dr. Williams, in order to get schools reopened before the end of the school year, would you consider diverting all of the rapid tests that the province has to the schools to test students and staff?
Well, that's a good question. The point we're looking at there is that up until we closed, we were doing testing on any student who had symptoms and having them go and obtain it at a testing center. We have been noted by the Ontario Health that they had well beyond the capacity to take all of them on, and a number of the centers have been doing that. We had undertaken some testing with rapid in one of the locations. And again, you can see with our volume of testing down, when we open, the main thing we want to make sure is, are the health units prepared to do all the case contact management, have the numbers decreased to a level, and we have been assessing and asking our MOHs that question, and we're affirming that pretty well all of them are ready to open when they're asked to do so because they feel they have reached the case contact management, which would include testing, and that's predicated not just the testing of the student, but also testing of any contacts and family members in a timely fashion with a PCR test. So we haven't rolled out the rapid testing in that setting. We've made it available if they so wish to use that at the health unit level. And of course, the Ministry of Education is prepared to continue their testing as they had been undertaking with a third party prior to the closure earlier on. So all those tests are available, but the main thing is that we want to make sure we have the capacity to do all the screen at the door as well as the case contact management.
Follow-up.
Thank you. Looking at the vaccination numbers the province provided today, Dr. Williams, now over 61% of Ontarians over the age of 12 have been vaccinated with at least one dose. And that apparently is where we should be looking at stage 1. So are we now looking at opening the province before June 14th? Are we on that 2-week clock now? And if not, why not?
The step 1 did require at least one metric of over 60% of the population not only having been vaccinated, but we would like to assume that also they're vaccinated and have immune status effect. That usually occurs 2 weeks after they have been vaccinated. So that is happening now. We've had an excellent response, and I'll see if Dr. Heyer wants to make any comments about the turnout on that. So besides the vaccination rate, we also are looking at other metrics in there, which includes the hospital data, the positivity rates, the different factors that are in there. So one of the most important ones is we want to have at least 60% undertaken, and we'd like to have a sense that 60% have mounted some immune status in that time before we open up. I'm not sure if Dr. Har, you have any questions about the vaccine turnout now and the performance, which is quite exciting to hear about.
Well, I think absolutely just building off what Dr. Williams is saying, this is there's been a tremendous number of people that have been vaccinated, and we were just below 65% of the above 18 population vaccinated prior to sitting down today. And so we're hoping that we'll be over 65 today, and we're continuing to progress with doses across Ontario in various different age groups. And as you pointed out this in the question, that was the over 12 group, and so that is again very exciting. I think it really illustrates, as Dr. Williams said, just one of the factors that we must consider when thinking about opening. And Dr. Williams talked about we still having on average 1,100 new infections reported per day. And so we cannot forget that. We still have a significant number of people in the intensive care unit. So we have to think about the hospital capacity, the public health capacity, and the potential for additional spreading of infections. So vaccine is just one part of that. However, a very exciting part, and one that is progressing very well.
Next question.
Chris Harold, CP24.
Good afternoon, doctors. Public Health Ontario says they will not implement a mass screening protocol for the B1617 variant, and instead will rely only on whole genomic sequencing of less than 20% of positive samples. Why is this variant being treated differently than the earlier variants of concern? Is it because of cost? Is it because of capability? And why is it taking so long to publicly communicate the count of B1617 in a timely manner?
Okay, so to the answer to your questions, I'm going to focus on number two. The main issue is the laboratory technology that's utilized to do a rapid screen PCR that was very much readily available for assisting with the B117, then the other side ones of the P1 or Brazilian variant, as well as the 135, the so-called South African variant. So that availed itself to a PCR type of screening test that was readily available and developed by our local laboratory here. They have been working stridently to try and get something that would help on that. They have not been able to achieve that, as other labs have not either. So we'll continue to look to see if there's some more rapid screening process that might be available. In the meantime, then the recourse is to depend on whole genome sequencing, and then to look at how one would do so, because that is much more laborious and time-consuming, exacting it is, and breaking down the sub-classifications of the 617. So the answer is it's a capability one, as all labs around globally are trying to look at some methodologies to expedite the surveillance technology. But at the same time, we're going to be looking at which ones we can address in the high-risk categories and compare those in that, and watching the growth of our variants overall, because they will still show as a variant group, but not to the specific level. And so we can ascertain if there's sudden surges in that would be concerning to us. So I alluded to already, we've identified a number through the whole genome sequencing combined with our lab and the National Medical Laboratory. But we are continuing to look for any updates and further enhancements that the Public Health Laboratory system and our experts at Public Health Ontario can bring to us to assist in this new variant and its assessment and monitoring.
Follow up.
Will those 80 plus be able to book second dose appointments soon, as was stated by York Region's Chief Medical Officer of Health recently? And if so, when will they be able to do so?
That question, we've been carefully planning out second dose rollout plan, working together, and there will be a vaccine update tomorrow where we will talk about a number of different things to provide further updates on the rollout. And what I can say is that we carefully consider clinical reasons for exceptions to the second dose, and we consider what the supply is and how that's being delivered across the province. You'll recognize that there's 34 public health units each has received allocations based upon their population base, apart from those where there were hotspots, and there was additional allocations to those areas. So it's really taking a provincial view and ensuring that the specific beauty and specific logistics that may be present within a public health unit are also considered in thinking about how do we make decisions provincially. But having said all of that, there will be an update tomorrow. Tune in to the briefing tomorrow.
Next question.
John McGrath, TVO.
Good afternoon. I've learned of a pharmacy in East Toronto that had people lined up for their second shots of AstraZeneca and has basically canceled those appointments because they don't have any kind of clarity from the province about when they will get supply available, and they don't believe that, given the short timelines, specifically the expiry date of AstraZeneca doses that are coming, they don't believe that they can administer those vaccines safely in the limited time they will have. Do you have any estimate of how many AstraZeneca doses are going to be wasted because the province hasn't been able to move quickly?
Thanks for that question, John, and nice to hear from you. So the AstraZeneca work has been we have been very busy with the AstraZeneca vaccine and what was available. And you may recall that when we first started AstraZeneca in early March, we started in 3 areas: Kingston, Toronto, Windsor, Essex, and also in 6 public health units that had primary care practices providing AstraZeneca. Those were the initial areas, and that's the group that currently has the opportunity to make a choice to proceed at a 10 or 11 week dose interval. But that requires, because we rolled AstraZeneca out to various other areas in the province, where the AstraZeneca was at the time of the pausing of the first doses was a number of different locations. So that required bringing those AstraZenecas out of other areas to bring back to the areas where there was the opportunity for the 10 weeks. And along with that, we need to make sure that the AstraZeneca that was present in those locations is safe and is effectively able to be provided. We have delivered 26,000 doses to pharmacies in the 3 areas, and we continuing to evaluate another portion of the AstraZeneca to ensure we get it out. There is the opportunity prior to May 31st to provide those doses. And in fact, we have seen approximately 7,000 second doses that have been given over the past 3 days.
Follow-up?
The question I asked was, do you know how many doses are potentially going to go to waste? Because if the expiry date is May 31st, it's May 27th right now. Some of these pharmacies have not yet received their supply, and they're going to be asked to use up dozens or potentially hundreds of doses of vaccine in 96 hours, 72 hours, that kind of thing. Something here is not going to work. The math is not actually going to solve. So again, do you have any estimate of how many doses are at risk of going to waste?
Well, we're making our best efforts to get the AstraZeneca in a safe way to the pharmacies to allow it to be provided. The math isn't necessarily the way that you're thinking of the math. We will be providing it to pharmacies to be able to effectively deliver it within the time frame. That's our goal. That's our hope. I can't predict. I'm hoping that we won't have any vaccine that gets to the expiry date.
Next question.
Brian Lilly, Toronto Sun.
Good afternoon, doctors. As you know, Premier Ford has written to local medical officers of health, unions representing education workers, and a number of other health experts across the province, asking for their advice on reopening schools with a number of specific questions. I'd like to hear from both of you. Can you say definitively that reopening schools to in-person learning is safe for both students and teachers under the current circumstances across Ontario?
So thank you for the question. Yes, we received the survey letter and understand that the Premier is looking for responses from all sectors by Friday. So as I commented on previous times, I've been supporting opening schools for in-class attendance. The issues around the health of the students and development, other things have been raised to my attention by different experts and by a number of my medical officers of health. I think that, as I said at that time, besides our part in public health being supportive and doing the case contact management, it involves a number of sectors being assessed. That includes the boards of education, the Ministry of Education, other consultants, as well as the teaching, the teachers, the administration staff, the unions, etc., because it is a group effort. And that was a group effort that we did before we closed, that maintained that the schools were safe. And all the measures that were in there, our cohorting, our masking, our distancing, our personal protective equipment, different things like that, as well as our screening was in place. Now our numbers have dropped back down, and it's our case contact management has improved on the public health side. So we are assessing that with our medical officers of health to see if they are prepared to open in there and do their part as far as the ongoing work with the school nurses, doing the screening, as well as the case contact management if and when a case shows up, to maintain the same level of safety that we had in the schools prior to closure for the remainder of the school academic year. So we'll be looking forward to seeing what the results of all the rest of the sector's feedback into this process, which I think is expected on Friday.
Follow-up?
Dr. Williams, you speak with local medical officers on a regular basis. A number of them serve on the public health measures table. Can you tell me whether you've heard any feedback from local medical officers saying that their areas are not ready for a return to in-class learning? And if so, can you tell us which regions are saying that they are not able to? For example, Dr. Davila yesterday was asked several times and did not give a clear answer. Is she one of the members of the public health measures table that is opposed to a return to in-person learning?
We have had discussions, and the only one I know that definitely says they can't right now. I know the medical officer there, Dr. Leanne Catton from Porcupine, said right now it's a huge amount of cases they're having throughout their community. The most they've seen during this time, they've superseded even Peel in its cases per 100,000. It's stretching all the resources writ large, and says, unfortunately, I would have really liked to have the schools open, but this time I can't do that. We're consulting with the other ones at this time. So far we have one that said they're not sure. We're going to have some more discussion with them in there, but I can say that the feedback I had as of today, all the ones around the GTHA say they have can do the case contact management and they're prepared to have their schools opened.
Last question.
Cynthia Mulligan, City News.
Hello, Doctor. This is reopening schools is a highly divisive and emotional issue, particularly for parents. I'm one myself. I guess, could you be more clear and answer as you would to parents? Is it safe for our children to go back to school? Will they be safe? Will their families be safe when they return? What is your instinct on that question?
So I think that's a very important question, because I think it's very much in the minds of parents who want to know, as compared to when we closed, is it safe? And at the time, we closed preemptively at that time because while we knew the schools were safe and there was an ongoing transmission within the schools, except for a few cases that we thought might be in a classroom, with the overwhelming increase in the community numbers that we rose up rapidly in the third wave, because we could not guarantee with our public health monitoring to assure the parents of the safety at that time, we preemptively closed the schools. And because we wanted the schools to have the history of being safe, having been safe, and we didn't want it to open now until they are safe. And we now feel that from a public health standpoint, we're prepared to handle that. Our case numbers are coming down rapidly. We're hoping to, in the next week or so, to even get down even lower, our positivity rates down. And the other thing now is that As Dr. Hires alluded to, right now, 65% of the adult population have been vaccinated. Many of those are parents of children going to school. Staff, administration, otherwise are getting vaccinated, as well as we're starting to make inroads into 13 to 17-year-olds vaccinated as well. So that was a factor we did not have at the start and the outset between the second and third wave that we have in place now. So I think in some sense that means safer, especially if we keep going out, getting more vaccines done and covering that off there, because as of this time, we don't have a vaccine for those under the age of 12 in there. Not that they have contributed a lot to hospitalizations or severity of cases with the younger children, but they have been known to carry and transmit. But if the adults are all vaccinated, it becomes less of a concern in general, writ large. So that's another added tool we have to make it sure that the schools, when they do open, are safe in there. But I think the parents, and that's why it's important, as I said before, they're a major factor in here to saying that you want to ask the questions to your public health unit in your area, ask the medical officer of health, ask their school nurses, the questions you need to want to ask to assure yourself that if your child's going back into the in-class attendance, that you're satisfied that it's safe. And so I would say it is. But I think you need to ask the questions you wanted to ask and to get the answers you deserve to hear about that aspect of safety. So, again, everybody's doing what they should be doing. Numbers coming down, getting ready to move into the framework, all moving in the right direction. And it'd be great if the students, in my mind, could be back in for those 3 to 4 weeks before the summer break and then getting ready. What we'd hope for is a more normal fall program for them.
Follow up, and this is the last question.
Thank you. And I know this has been touched on a little bit in prior questions, but I am hearing that the government is watching these falling numbers very, very carefully. We know that the targeted date is around June 14th to open up. But with these falling cases, with all the new emerging evidence that you are getting, would you be comfortable if the economy starts reopening sooner than June 14th?
So the economy, I think you're alluding to certain facilities and aspects that we said would be in the first step of the roadmap was dealing with an enhancement of outdoor activities, looking at some aspects that we would try and consider in that for some retail and areas in there. So we are looking at those as well in there, trying to improve as much as we can, because when those numbers are right, and Dr. Hires alluding to not just the vaccine coverage, as you know from a while back, I said with the variants of concern, and we're watching the 617, I was looking for a number well under 1,000. We still are at that 1,100 mark this week. I was looking at more the range of about 500 to 600 per day that we would like to see to get down to, because when we come down and we open up these different things, including some aspects of, as you called the economy, or different factors or sectors that would open up for public consumption with greater mobility and movement, we would like to do so that when they do open, they stay open. And I think that aspect, combined with the ongoing vaccination, not only the first dosing, we may be at 65. I'd like to see us above 70%, heading up higher if we could. I think in Ontario we can do that. And then, of course, as Dr. Hire alluded to, I'll give some updates tomorrow on how we might start to really assertively address the second dose issue as well. And so we're hoping to get some updates on that. So all things are moving in the right direction. But again, we want to do it steady, on a bit of a slow pace, because we don't want to have open and then close back down again. We don't want that. We want to get out of this third wave. We're still not out of the trough that we were between the second and third wave. So we're still not even down below what we were before the second wave. So we really want to make sure we get down there. So we have some work to do, but I'm hopeful that by that date, we'll be pretty close to that mark and can move into the framework. So I'm optimistic with what we're seeing today and in this past week.
Thanks, everyone.